Why do women have different AMH levels?
Very good question. So women have a different AMH levels because they were born with a different amount of eggs on the ovaries. Yeah. So like it's parameter of the body. Like let us say some people taller than others. Some people have a very tall height. Maybe their height is 190. Yeah. Some people have average height. Maybe their height is 175. And some people have a short stature, which means their height may be 150. So we don't say this person is sick and their height is. AMH's egg reserve is like this. Some women are born with their feature in their ovaries, in the egg reserve. It's feature that they were born with lots of eggs. Women with PCOS are born with lots of eggs. They were born with 2, 3, 4 million eggs in the ovaries. Women with who is going to have early menopause or premature ovarian insufficiency and going to have a fertility problem if they start family late are born with a low number of eggs. They are born maybe only 100,000 eggs or 200,000, and by the time they reach 30, they may run out of eggs. Some women unfortunately run out of egg reserve before the age of 25. They are born with very little number of eggs. So, which means they had a high AMH when they were younger, and they had the normal ovarian function. And if they delay, they run out of egg reserve, and they can have fertility problems. So, and yeah, so women, when you measure different AMH, different antral follicle count, that means these women were born with different number of eggs. And this is why the AMH is different, antral follicle is different. That's why the egg reserve are different. This is why the fertility plans have to be different. If you have 10 classmates, yeah, so and then they're meeting at the age of 30 and they say, let us check our AMH, yeah. So before they check their AMH, these 10 classmates, the same age, which I mean the same age, at the age of 30, they assume we have same fertility. Why? Because our age is the same. But if you check the AMH, out of 10, maybe like 2 of them have a PCOS, which means they have very high egg reserve, and 2 of them have a very low egg reserve. The AMH maybe only is like 4 or 5, and remaining like 6 have average egg reserve. And you give 3 different advice to this different group. So for patients with PCOS, I said, don't worry, your egg reserve is good. Even after like 5 years, 6 years, 7 years, you can try to have kids and you shouldn't have much problem, provided you don't have any other fertility problems and your partner doesn't have any other fertility problems. But in women with a low egg reserve, say, look, your AMH is only 3-4. And within 3-4 years, you have to ensure you complete your family. If you want to have 3 kids, you should start now. If you're in relationship with a male partner and complete your family within 5 years, have 3 kids. If you conceive naturally, excellent, do it. If not, then you need to have IVF. Or if you can't have kids, you need to preserve your eggs by egg freezing or embryo freezing using donor sperm if you're not in relationship, or embryo freezing using your partner's sperm. If you trust your partner will be happy to use those embryos, give you consent, and you're sure that you will be in a relationship when you're ready to have kids. This is why just doing simple AMH tests, not only once, maybe twice, and maybe doing IFC as well. Yeah, so you do AMH twice and you do AFC, and after 1 or 2 AFC, 1 or 2 AMH, you can tell who has a truly low egg reserve. Yeah, so this group of women at risk, if they ignore, they can have a lot of fertility problems. And this is the group of women who actually normally need donor eggs when they already have kids, because they already run out of egg reserve. And this is why you should not ignore. You should not say AMH is rubbish test. Don't trust. It doesn't tell you anything about your fertility. No, it's misinformation. Yeah, so this is information given by doctors or influencers who do not actually understand the role of AMH. AMH is not, we're not saying AMH is a fertility hormone. AMH is one of the fertility tests. Semen analysis is a fertility test. AMH is a fertility test. High gauge is fertility test. So pelvic ultrasound is fertility test. There's a lot, because fertility is not single disease. This is multifactorial. There's lots and lots of like 20, 30, 50 causes things can cause fertility. AMH is one of them, and it's the most important one. Why? Because it tells egg reserve. If you have a low egg reserve, your fertility drops. If you do not have egg reserve, you cannot have genetic biological child. So this is why you should not ignore AMH. You should take as a part of one of the tests you do to understand your fertility. If you have to do any test, you should do one test, which is AMH. So then you should do all the tests if you're actively trying. If you're not actively trying, you shouldn't do high causing. Yeah, if you shouldn't do any other fertility test generally. But even if you're not trying, you should do AMH. Why? Because it predicts your future fertility. So whether you're going to produce eggs in 5 years or 10 years, and it is the most informative test. Two things is most informative when it comes to fertility planning. We're not talking about fertility treatment. We're talking about fertility planning. It's a different thing. Fertility planning means any given time you're planning your future fertility. You are planning when you're ready, when you're going to have kids, and how many kids you're going to have, and how you're going to have the kids. Yeah, with your partner, or with IVF, or with donor sperm. That's a fertility planning. You need to know only two pieces of information for fertility planning: your age now, and age when you want to have kids, and AMH levels. Yeah, maybe repeat it twice, because we'll discuss later. AMH fluctuates, goes up and down by 30%. If you do twice, you have a good idea about your AMHs, and maybe you can also do pelvic ultrasound scan to understand if you have any ovarian or uterine pathology. That's the third test you can consider. So this is why AMH you cannot just dismiss, you cannot just ignore. That is a hormone produced from your growing follicles. That's a reflection of your egg reserve. It's like how much of time you have. Okay, I'll explain in very simple terms. Yeah, let us say you have a car. Yeah, your car is fully functioning. Yeah, doesn't have any problems, but you're running out of petrol. And if you run out of petrol, doesn't matter how functional your car is, you cannot get to your destination. You stop. So AMH is an indicator of your, like, how much petrol you have. Yeah, in your fertility, how much reserve, how much fuel you have left. If this indicator, we shouldn't blame AMH. AMH is just indicator of how much of sleeping eggs you left. If you run out of egg reserve, doesn't matter how fit, how healthy, how much sports you do, how much of diet you are doing, it doesn't matter. That means you run out of fuel. So this is why there's a lot of misinformation. The reason we're doing this live streams, Gabi, is I can see a lot of misinformation, a lot of misunderstanding, including by fertility specialists. They do not really understand the role of AMH. Oh, AMH is not, it doesn't tell anything about your fertility. No. AMH is egg reserve test. It tells how much of egg reserve you have got, and that helps you to plan your fertility and seek help if you have to during right time. Yeah, so this is why it is very important for whole public, including medical professionals, to understand the role of AMH, including role of AFC. So this is why we're doing this live stream.